Welcome to this episode of the Buddhi Insight, a part of the Neurokrish immersion series. Today we are talking about the gut, brain and mind, not just the gut, brain and mind connection, but we're going to take a very specific view of the autonomic dimension from emotion to the physiology of human experience. There is a patient I remember very clearly, and I'd like to start by describing the case because that tells us about what the real life problems are at this interface. This was a doctor's wife, 42 years old, very well informed, concerned and engaged with her health. And yet, for a 2-year period, her life had come slowly apart. What was troubling her? She was constantly hungry. She was forced to eat every 2 hours. She had gained about 10 kilograms in weight. She was frequently having to run to the bathroom very soon after every meal, and she had this what we call urgency. Fatigue had become a huge problem. She was constantly feeling fatigued, and she felt sleepy all the time but was never able to sleep to her satisfaction. Now, being a doctor's wife, she was extremely well investigated and extremely well worked up by the time we met her. And every possible scan under the sun had been done. No problem was found, and it was decided that her problems were psychological, and hence she was sent to us as somebody with a psychosomatic problem. So she had met the gastroenterologist who said, "Oh, you have irritable bowel syndrome." She met the orthopedic surgeon who said, "You have fibromyalgia." And she had been even seen by a psychiatrist who diagnosed atypical depression. But whatever had been done for her, nothing worked, and whatever test she had came back normal. So that's a very unique conundrum that very often people face. So what was she told? She was told there's nothing wrong with any of your organs, and there's something wrong with your regulation, and it's most likely psychosomatic. It's in your mind. Now, one thing that we often tell people, therefore, it's because you are under stress. So what really is stress? Because it's a word that we use very, very casually a lot of the time. To put it very simply, stress is the gap between your expectation and your reality. So when you expect something to be the outcome, you are expecting to meet, for example, your boss this morning, and you're expecting that meeting to go well. And in reality, your boss goes after you and gives you a very hard time. Now that causes you stress because you went there thinking, I'm going to have a good meeting, I've been doing a good job, but you come out feeling as if you got ran over by a truck. That gap is what causes stress for all of us, and therefore when life does not match what we think it should be, our mind starts to react with anxiety, with anger, with frustration. And this really is what we call stress, and this really are what the symptoms of stress become. So it's not just a thought, stress is a whole body event. And what happens? Your heart rate tends to go up, you start breathing heavily, and your muscles become tense. But very, very interestingly and importantly, because today we are talking about the gut, one of the things that happens is that your gut gets activated. And think about this, how often have you felt like going to the bathroom just before an interview? Or how often do you feel my gut is unstable just before you travel? And it's really inconvenient for you to have to go to the bathroom. This is how stress and the gut are very closely linked with each other. So your emotions lead to a certain experience. So when you have an emotion, you perceive something. There is a cognition that is perceived. There is a feeling that is perceived. But what gets activated is what's called your autonomic nervous system. We've talked about this many times before in this podcast. I'd like you to go back and listen to the episode on the wandering nerve, which talks about the vagus, which is a very critical part of the autonomic nervous system. But this is what results in your fight, flight, or freeze response. So now imagine that you go somewhere on a holiday. It's summertime. I'm sure many of us try to go to the hills. And let's say you went to the hills on a holiday and you went on a morning walk. and you're walking in the Nilgiris and you meet a bison. Now what happens to you? Your heart beats fast, you start shaking, you sweat in that cold, you can't get your breath, you feel like you ran a mile. So suddenly your entire system changes. Now what causes that? It is your autonomic system that causes that, because this is your silent nervous system which is preparing you either to fight or flee. And that is the response, the physical response that we get that helps us fight or flee. The heart beating fast is sending more blood to your muscles. Your muscles are ready for you to run away or to fight the bison if you think you can. And that's the autonomic nervous system. But it doesn't stop with just activating those things. It can make your gut react. So your physiology can include your gut reacting. And you come across situations where people, for example, wet their trousers because they were afraid of something. Fear made them wet their trousers. Now there's a very classic example of how your autonomic nervous system can overreact. And then you have all these physical symptoms of heart going fast or breathing heavily and so on. And what do? We either adapt to the situation or we avoid that situation. And basically this is our fight, flight or freeze response. Now when that is over, you'll go back to where you were staying and you'll tell people you were staying with, oh my God, I met this bison and this is what happened to me, this is how I felt. It becomes a story. In that situation, you're able to decide that it was that particular trigger, meeting the bison, that made you feel that way. And there's no worry in your mind about why you felt that way. But imagine you felt the same way without the bison being there. Imagine that spontaneously sitting in the comfort of your room, you had a fight, flight or freeze response. That's what we call a panic attack. And what's that? That's your autonomic nervous system on overdrive. And this is something also that happens to a lot of people. And a part of your autonomic nervous system being in overdrive is your gut being unstable. And this is something I'd like all of us to keep in mind as we go through this. So therefore, let me conclude this segment by saying to you that stress is not just a psychological response. Stress is physiology wearing the mask of emotion. And this we need to keep in mind. Now we've talked about this autonomic nervous system repeatedly, but let's say something more about it, because it's something that most people, when I tell them, it's the first time they are hearing it, that there's something called the autonomic nervous system inside me. Now why is it autonomic? And this is how I explain to people. When people walk into my room, they walk in, sit down, they show me their files, they start talking to me, and I tell them, look, these are all voluntary actions. You decided to do something, you're doing it. At the same time that you're doing this, your breakfast or your lunch is being digested. You don't control that. At some point of time, your body will tell you you're hungry or thirsty or you have to go to the loo. So that's an autonomous part of your nervous system controlling all that, and hence we call it the autonomic nervous system. Controls your heart rate, it controls your breathing, controls your digestion, it controls the internal state and balance of your body, and it operates below your conscious awareness. And this we have to internalize and understand. It's got two parts. It's got a sympathetic nervous system, which is the system of urgency, which is flight, fight and survival, prepares you for action. It suppresses everything that's non-essential, including digestion. I mean, you can think of times when you're on overdrive trying to complete a project or study for an exam and you'll forget to eat. And that's your sympathetic overdrive that's working for you. It elevates your heart rate, your blood pressure, your alertness. At the same time, there's another system called the parasympathetic system. This is your system of restoration. Helps you rest, helps you digest, helps you recover. And when do you do most of that? When you sleep, which is one of the reasons why we say get enough sleep, because poor sleep means your body has not had the time to rest and restore itself. Now the parasympathetic allows food to be processed. It restores your energy. It enables your healing. And between these two systems, the sympathetic and the parasympathetic, lies your balance of health. And I think that that is something that we have to keep in mind. Your autonomic loop, therefore, is a bidirectional system. From your brain arise thoughts, perception, memory, and meaning. From your autonomic nervous system arises the sympathetic activation or parasympathetic restoration, or indeed balance, regulation, which is something that is very, very important. And these are signals from the brain which are shaping your body. And then, of course, one of the things that gets influenced because of this is your gut, your viscera, your hormones, your immune system, your muscles. All this gets influenced by this neural regulation that is happening. And then this feedback goes back to your brain, and that shapes how your brain is thinking about how you are. And I think that this loop, and we've got this autonomic loop as an image in the visual guide. So if you're watching the YouTube version of this podcast, you'll be able to see the image. And that shows you how there is this constant brain-body connection. Again, I'll take you back. Please go listen to the Wandering Nerve podcast for more details on the sympathetic and the parasympathetic nervous system and the role of the vagus nerve. Every emotion that you feel, therefore, is an autonomic instruction to the body, and the brain and the body are constantly in connect. Now, how does stress, therefore, become physical? Now, your brain does not store emotion in isolation. It stores it in various circuits. And I often tell you this, if you put a line through your ears, right in the middle on either side is your hippocampus. That's just the size of a finger joint, and it is the storehouse of your memory. Then you have right next to it as its neighbor, the amygdala. And the amygdala is the storehouse of all your human emotion. And then, of course, you have the hypothalamus, the brainstem, the rest of the limbic system. And this is the emotional center of your brain. This is the part of your brain, the oldest part of your brain, which you share with a mammal like the rat. And one of the things that influences this part of your brain is smell, which is why all of us have such a powerful smell memory. If you have any knowledge of Chennai, and if you've ever taken a train into Chennai, very often you wake up in the morning at 6 o'clock with a smell, and you know you're nearly home. What reminds you that you're nearly home is the smell of Chennai. It's actually not a great smell. It's somewhat sweet, it's somewhat metallic. It's not exactly pleasant, but it makes you happy. It makes you happy because you're near home. And it's not just Chennai as a city that smells. Every city, every location, even your home has a familiar smell that will tell you that you are there. And that's part of your smell memory, which activates your limbic system. Now, what happens when this part of your emotional brain gets activated and the problem that it's dealing with is unresolved is that this part of your brain then activates your whole body. And that's what I was talking about as the fight or flight response. And we talked about all the physical symptoms, palpitations, breathlessness, dizziness, bowel disturbances, all these being set off. Now imagine a situation where your problem is not the bison in front of you, which you're fully aware of. The problem is the bison in your unconscious mind. It's something, a repressed memory, something that you're upset about, something that made you angry in the past, which you have swept under the carpet called your consciousness, and you're no longer aware of it. Now, when this gets activated, then that unconscious conflict, unresolved conflict that you have about that gets activated. And that, instead of just being a cognitive phenomenon, you think about it, it also causes your autonomic nervous system to get activated, and you get autonomic dysregulation, and hence you get a lot of the physical symptoms. Now, if you go back to Mrs. A, you'll remember all the different symptoms she had. She had to keep eating, she was putting on weight, she felt fatigued, she had to go to the bathroom many times, she had a dysregulated autonomic nervous system. So the body begins to speak to us about what the mind is not able to resolve. And the gut, therefore, is one part where this is most visible to all of us. And why is the gut so important? It's richly innervated. Many parts of your nervous system plug into your gut. It's connected to the brain through the vagus nerve, through the autonomic pathways, and various hormonal signals. And when the system gets disrupted, you get irritable bowels, you can get bloating, you can get urgency, you can get constipation, your appetite can be altered. So your gut speaks to you about your stress, but you don't realize it's your stress that's causing it. You think there's something wrong with my gut. And that is exactly what happened to Mrs. Hay, whom we were describing to you when we started this podcast. So it's a feedback loop where fear, worry, anger, uncertainty, emotional overwhelming, they activate the autonomic signals which go through your vagal pathways, through sympathetic activation, through various neurotransmitters and hormones. Your gut function gets disturbed, motility, the speed at which your gut moves can get disturbed, secretion can get disturbed, blood flow can get disturbed, sensitivity can get disturbed, and listen to this one, microbiota. Microbiota are those microbes that have a genetic imprint on your gut. And believe me, they don't just belong to you. They belong to your ecology, they belong to your history, they belong to your genetics. You inherit them, and it's your lifetime of a diet that is actually stored in them. So they get in some way activated, and then of course you start perceiving symptoms of pain, bloating, urgency, nausea, fatigue, altered appetite, and this perception amplifies signals back to the brain, and this creates a self-perpetuating cycle because that's making you anxious too. And so you get all the more anxious and the gut gets worse. So you set up a vicious loop or a vicious cycle. Again, there is a very nice graphic that explains this to you in the visual guide to the podcast. One very interesting thing which most people don't realize is that about a third of all patients we see in clinics, and I'm not talking about my clinic, I'm talking about clinics world over, have no structural abnormalities that explain their problems. And we are therefore talking about dysregulation causing multiple symptoms. And many patients who come to us with what we call long COVID symptoms actually have autonomic dysregulation. It goes undiagnosed, and the best way to fix long COVID symptoms is to stabilize the autonomic nervous system. But if you don't diagnose it, then obviously you're not going to fix it, and that's part of the problem. So your gut does not just digest food, it processes experience. And one thing that I often tell people, especially young people, is that it's fashionable to switch to a high protein diet because you're in the pursuit of something which you think is fitness. It's fashionable to change your diet to match what seem to be modern expectations. But please remember, your gut is imprinted with what your ancestors ate for centuries. When you change, you can expect that there will be problems that are likely to follow. And that's something a lot of people are not necessarily aware of. Now, when this imbalance becomes persistent, as it did for our patient Mrs. A, you get dysautonomia. Now, how do we diagnose dysautonomia? Apart from symptoms, and I've talked to you a lot about symptoms, there's something we do which is remarkably simple in clinic. We take your pulse and your blood pressure lying and standing 3 times at 5-minute intervals. Now sit with that. Such a simple thing to do. Your pulse and blood pressure measured lying, measured standing, repeated after 5 minutes, repeated again after 5 minutes. Now what helps us make the diagnosis? It's called postural orthostatic tachycardia syndrome, and POTS. POTS is when your pulse rate goes up by more than 30 beats when you change from lying to standing. It's so simple to test and so simple to identify, but yet most people don't have this done. And there is an accompaniment to POTS. It's called orthostatic hypotension. And what is orthostatic hypotension? When your blood pressure falls by 20 millimeters of systolic or 10 millimeters of diastolic when you go from lying to standing. That's called orthostatic hypotension. And these autonomic symptoms can affect every part of your body. So when I talk to patients and take them through the checklist, oh, do you get dizzy? Yes, doctor. When I stand up first thing in the morning, I'm terribly dizzy. Do you get breathless? Yes, doctor. I get breathless ever so often. I don't even know why it's happening. Do you get palpitations? Yes. Do you start trembling? Yes. Do you have headaches? Yes. And what's the kind of headache that you have that's autonomic? The headache is in your occipital region, the back of your head, neck and shoulders. So it's like somebody suspended a coat hanger behind your neck. So it's called a coat hanger headache. It's a heaviness that you feel which is disturbing constantly in that area right behind your head and over your shoulders. So that's very typical. Altered patterns of sweating from just the head or sweating in various parts of the body, very autonomic. Dry skin, very autonomic. Tremors, very autonomic. So there is a whole set of symptoms other than gut health symptoms that goes with people having dysautonomia. So we found these in Mrs. A, and we examined her and we found POTS, and we examined her and we found orthostatic hypotension, and that's what made us conclude that her problem was, yes, it was psychosomatic, something psychological contributing to soma or bodily disturbances, but the mechanism was the autonomic nervous system. And if we just treated her as atypical depression and tried to deal with her depression and anxiety, it was like we were trying to solve one small part of the puzzle. There's a whole big puzzle that needed to be solved, and we wouldn't have solved it if we had not diagnosed the dysautonomia in Mrs. A. And therefore, there is a whole psychological loop that gets developed with the body influencing the mind, and the mind reinforces the body, and that becomes chronic. Now, what does this result in? When you're sick constantly and you don't know why you're sick, you go to multiple professionals and they tell you, oh, there's nothing wrong with you. After doing very good tests, top of the dollar tests that you could possibly have, you start feeling helpless. You start feeling like, I don't know what's happening to me. I have no control over what's happening to me, and nobody is able to explain to me what's happening to me. That's exactly what happened to her. And what then happens is that you get very severe anticipatory anxiety. You worry about how today is going to be, how this meal is going to affect me, how travel is going to affect me, whether I can actually go to work today. And this causes chronic sympathetic activation. Your body is permanently in a state of threat. It's as if somebody suspended that bison in front of you 24/7. And even when there is no external threat, you're constantly feeling tested. You're constantly feeling under threat. Now, there's another very interesting psychological concept that I'd like to bring to your attention, because that explains why these things affect us so much. It's called locus of control. Locus of control, the best way to understand it is, if you see Modern Times, Charlie Chaplin, the movie, you will see that he stands in front of, a machine, and the parts keep coming in front of him, and he does a repetitive action ever so often. When the machine stops and the bell rings, that's when he gets to go, and have his meal. And when the bell rings again, he's got to come back to the machine and start working. And then if you've watched Modern Times, the movie with Charlie Chaplin, you will remember this scene. Now, in that circumstance, it is a very good example of how your locus of control is external. You have no control or agency over your circumstances. Your circumstances are controlled by other external factors, in his case, the factory. Now, if you're unwell with something like autonomic dysregulation, your circumstances are controlled by your body, and you feel you have no agency because your symptoms are so unpredictable. On the other hand, when you have control and agency over what you're doing, you become resilient, and that's called an internal locus of control. So what's desirable in psychology is that we all have an internal locus of control. And even if you're ill like Mrs. A, once we have told you that what you have is autonomic dysregulation, once we have explained the mechanism to you, once we've got you on a pathway to getting better, your internal agency starts to get better. You start feeling more in control of your circumstances. And that is so important because your perception modulates your autonomic nervous system. And once you feel in control, once you feel I have agency, what happens is your sympathetic overdrive that's causing all these autonomic symptoms starts to come down. So the brain doesn't just respond to reality, it responds to perceived control over reality. So you feeling that I understand why this is happening to me and I can actually do something about it is so important as part of that journey to your getting better. So this is why in Buddhi Clinic we have built not just solutions, we've built a whole system that can help people. Now, many people with these problems need medication, and these are stabilizing medicines that bring about neural regulation over time, and I'm talking 3 to 6 months, but they work. We have other biological solutions. We have a whole range of neuromodulation systems, non-invasive brain stimulation, TMS, TDCS, transcutaneous auricular vagus nerve stimulation, very, very important for autonomic regulation. All these things, neurofeedback, all this helps people get better. And to get into this, we put people through an assessment to help them understand their mental health, their physical health, and indeed their lifestyle and bodily health. All these three things, body, mind, and brain, all of them are very, very important in order to get better. We also put people through physiotherapy. We give them autonomic training, how to regulate their autonomic nervous system. We give them tips on lifestyle correction. And then, of course, we have a whole house of psychological therapy, psychotherapy, cognitive restructuring, mindfulness therapies. All this can help a person with autonomic dysregulation, as indeed our entire house of yoga, Ayurveda, naturopathy, acupuncture, all of which have a role to play in promoting neural regulation. So we need to work on the mind, we need to work on the body, we need to work on the brain, we need to work on the nervous system as a whole, and this integration brings back a sense of well-being, and in the longer term, this integration brings about resilience. You stop being vulnerable to autonomic dysregulation or sympathetic overdrives, which is what promotes your symptoms constantly all the time. So this integrative approach, which is whole person care, is what people with autonomic dysregulation, which I've described right through this podcast, need. And it's such an important component of long COVID symptoms, and we still meet so many people struggling with long COVID symptoms. And I really hope that this podcast helps you understand why you're having those symptoms and what you can possibly do about those problems that you're having. And the main takeaway that I would say is that you cannot regulate the brain in isolation. You need to regulate the entire system. It's not about working on the body alone or the mind alone or the brain alone. It's on working on neural regulation that becomes important. So let me go back to the protagonist of our story, Miss A. What happened to her? She actually got better. She improved. And the difference, I think, was that we did not treat her gut, we did not treat her joints, we did not treat her mood in isolation. We treated her autonomic nervous system, we treated her emotional regulation, we treated her behavioral patterns, her body stabilized, and her mind followed that improvement. Remember this. It's only in modern times that we separate mind, brain, and body and go to different doctors and different professionals to try and explore these different parts of ourselves. The human experience never separates all this. And if you go back to holistic medicine and ancient systems like Ayurveda, they do not separate all this. They look at whole person. And really, people with autonomic dysregulation need whole person care. So the truth that we return to, your gut, your brain, your emotions, they are not separate systems, they are one conversation, and your illness begins when the conversation breaks down. Healing begins when the conversation is restored and coherence develops. I hope you find this episode of the Buddhi Insight helpful. Please go back to the slide guide and we'll leave you with an infographic that tells you about how the gut, brain and mind interact through the autonomic nervous system. Thank you so much.